Hi everybody, this is the Diabetes at University channel. This video is about time in range. If you have diabetes, you benefit from understanding what time in range means, what it is. So watch this video. I will explain it in a simple way. I also will say everything that I say is based on either on academic research, which I will list below the video, and sometimes I have tips based on my own experience as someone with diabetes, and when I do, I will point that out so that it is clear what is based on research and what is my own opinion. Warning and disclaimer. You are watching a YouTube video. This is not medical advice. I'm just sharing my own experience and learning about diabetes management. In the making, I did my best to rely on medical literature. However, I cannot guarantee I always correctly report this literature. Further, this video also includes my personal opinion, and it might not always be clear what my opinion is and what the medical literature says. Even so, I hope the video is interesting and might point you into the right direction for learning more about diabetes. Before you act on what you hear in this video, make sure to first consult your medical team. Now, also, I'd like to say before I start, do not forget to please like and subscribe to this channel if you find this sort of video interesting. Now, time in range means the time that your blood glucose level is correct, that it is in the correct range, not too low and not too high. If it would be like I show here in the panel, where it's always in the green level, not too low and not too high, you would be 100% of the time within range. Now, do you think that is easily doable? Can you do 100% time in range in a day? Now, I think actually getting 100% time in range is actually really effortful. And it doesn't need to be 100% time in range necessarily. If you have 90% time in range, that's pretty good too. But if today your time in range is 100%, it actually means that your glucose has never been too low or too high, and it means that you're a master of diabetes management. And as I said, that actually is really difficult to manage. For most adults, the standard recommended range to stay in is between 70 and 180 milligrams per deciliter, which corresponds to 3.9 and 10, and to be there at least for 70% of the time. And I'll come to that in a second. This time in range is a great way of thinking about your glucose levels. It is much more meaningful than an average blood glucose value such as the HbA1c. And the reason why it is more useful than HbA1c. Now, that actually is my own opinion that it is more useful than HbA1c. Although there's a academic research that says time in range is a really good way of working and considering. With HbA1c alone, you can have lots of lows or lots of highs as well, and on average it's okay. But you might have lots of time that you actually not feeling so well because it's too low or too high. And the time in range captures that, and that therefore it is a really useful measure, and it's also easy to understand because everybody knows what it means to be roughly half of the time or roughly 70% of the time. That's something that you can work with. Now, as I already said, if you manage 100% in time, you're a true master of diabetes management. So give it a try. Can you manage it? But I think 100% of the time, if that's what you go for, I mean, that's not really realistic, because it's easy to be a little bit too low or a little bit too high for a short time of the day. Even if it is a few minutes, then you would go down a little bit from that 100%. So 100% is really difficult, and you just you can, because you can set your own target, right? So as I say, the target that doctors set is 70%, and we come to that. But maybe you can set your own target, and of course, when you do so, you should discuss this with your medical team. That's quite important. So what do the doctors exactly say? Well, they say that you should strive for 70% time in range as so like the minimum. And that corresponds to around 18 hours a day. That does not mean that the other 6 hours of the day it can be anything. There are also actually guidelines on what the other 6 hours then should be. And I've made a different video about that, so I'll have a link at it at the end of the video. And then you could ask this question, why exactly did it set it to 70 and 180, or between 3.9 and 10? What's the reason for that? And that's a good question, because it turns out that those values, actually the values that are chosen depend a little bit on the situation. So they have different levels recommended for, and by the way, in this video I only talk about adults, but for pregnant women they have different rules, and for older people, at least in some research articles, they have those too, and we're going to have a look at it now. So the recommendation for pregnant women is different, and for this, I look at a UK paper that I will link to later. So as I said, for the typical adult, it's between 70 and 180, or between 3.9 and 10. But for pregnant women, according to the UK paper, to which I have a link below the video, it is 63 to 140, or 3.5 and 7.8. And the reason for that is that if women stick to that for 70% of the day, or more, then they have better health outcomes. Now again, the link to that is below the video, and if you're pregnant or are planning a pregnancy, of course, don't rely on this video. Just go see your doctor, because that's something that you really need to discuss, and I'm sure you know and understand that. Now, there are several questions you might have about this time and range stuff. And one of them is if some doctors, if doctors say that 63 to 240 is good for women who are pregnant, why is that not good for all adults? And in anything above 140, if people have blood glucose over 140, that can be an indication of people having diabetes. Now, if you read the literature, and I have the link here, actually the consensus report also says that the ideal target, for all people is to stay below 7.8 millimole per liter, or 140 milligrams per deciliter. And they say this, this postprandial glucose level, that means the after food target of staying below 7.8 or 140, might be recommended if this can be achieved safely. And this is the key idea here: safety first. So what doctors don't want is that they say, well, if you have, say, a patient who says, well, I want to be below those 140, and therefore I go take more insulin, maybe I'm going to be low all the time. That's not good, because people then might suffer from lots of hypoglycemias. So it's only good if you can stay below 140 while also staying above this lower limit. The key idea, as I say, is that you want to prevent hypos, because hypos are, of course, extremely dangerous. Whether they are extremely dangerous, of course, depends on how low you go. And I have a different video about that as well, about hypoglycemia. This is a key issue here. I mean, safety is a major issue, because if you think about it, insulin is an extremely strong medication, and taking too much can be deadly. And so you're constantly walking a tightrope. Actually, as it says in the High Hold paper, people are walking a tightrope between the risk of being too low and being too high, and that's why there are different sort of like targets set. And again, you need to discuss this with your medical team. But the point is, of course, that this tightrope, this exactly why managing type 1 diabetes is so difficult. So now I want to talk a little bit how to get a good time in range. So now that you understand time in range as a concept, as an idea, let's talk a little bit more on how to manage a high time in range value. So getting 100% in time for one day is effortful, and for more than one day, probably quite difficult. So if you say, well, I'm going to stay 100% time range for 7 days, I wonder if you can do it. Leave a message below in the comments. I'm really interested to hear who can do that and how to do it. I mean, of course, it's not impossible, but it takes a lot of effort, I suppose. If you get 90% of time, 90% or more, you're actually doing really well. And I would say even getting 90% takes effort. So how do you manage it? How can you manage it? Well, I want to give some tips. The first tip is, of course, that you should frequently check your glucose sensor. By the way, this is my tip, right? So this is my own experience, that if you sort of like check your blood glucose regularly, you see when it maybe goes out of range, and then you can take action. So from now on, here from the rest of the paper is based on some of the tips of some of the experience I have gained with this. So one thing I should mention is that you benefit from using a glucose sensor, and ideally one that can warn you, that can give you alarms. The G7 actually is really good, because the G7 is not only able to tell you, oh, you're too low or too high, but the G7 can tell you when it's going to be too low. So for example, it can give you a message of, in 20 minutes from now, if you go on like you do now, you will have a hypo. And then oh yeah, okay, so I get this warning, okay, and then you take some glucose tablets or you drink some orange juice, and then and that risk is reduced, which is actually really great with the G7. I have used the G7 for a while. This is what the G7 looks like. So of course, it is a great little sensor. It is the Dexcom's top model, I think. And it's really good for people who, for example, struggle with hypo awareness. But I think that when doctors say you can have this upper limit of 140 or 7.8, you need to do that safely. One way to do it safely, of course, is by using something like the Dexcom G7, because that warns you when it's going low at a time that you're not yet low. So I find that is an ideal device. And by the way, I was not sponsored by Dexcom to say this, so I'm not even using the G7 myself right now. Well, I think if I think about it, it's in many ways an ideal sensor. But you don't necessarily need a G7 to have a good time in range. What you need to do is, like, if it goes like this, if it goes up all of a sudden unexpectedly, it goes out of range, then take action and keep monitoring. Now, what sort of action you should take depends a little bit on your situation. It depends on so many factors that I cannot give generic advice on there, except from look at it and see how your body responds to the actions that you take. For example, if you go for a walk or for some exercise, how much does that lower your blood glucose, if at all? In my case, doing a little bit of biking or going for a walk actually really makes a difference. And that's quite nice. But again, whether that is the case or not depends on a number of factors. But so what you need to do is you need to develop a good strategy for both going low and for going high, and you need to have a good plan in place of what to do when those things happen. And what exactly you should do, I think, is exactly something that you should discuss with your medical team. So one thing is, for going low, I think you should always carry some glucose tablets with you, no matter where you go, right? So always have them in your pocket, because they really, of course, are super effective in rapidly increasing your blood glucose when it needs to be increased rapidly. When it goes high, I think it's a little bit different. It's more difficult maybe to deal with it. But when you see it going high, it's time for action. Now, what is a good time for action? I think is when it goes between, say, 140 and 180, or between, say, 7.8 and 10 millimole per liter, because sometimes you see, it keeps going up and up and up and up, and at that time it's still, if you take action then, well, that's great. But if you wait until it goes up and up and up, then it's also harder to get back in that range, and your time in range will not be as good as when you take action in time. Now, again, this is my personal opinion and my personal advice, but so I personally think if you take action in time, you really benefit from it. But again, something to discuss with your medical team. When should you take action, and what sort of action should you take? Also say, if you're in the United Kingdom and you have type 1 diabetes, make sure you go on the DAPHNE course. That is offered by the NHS, is really good. Not everybody that has type 1 has been on that course, and there at that course because they look at your individual situation, they give you advice. Well, this is what you can do, this is when you need to correct, and so on. And that is the sort of diabetes education that helps you to have a good time in range. So if you're in the UK, do that. And if you're in another country, check with your health insurance or with your medical team whether there is diabetes education that you can participate in, because diabetes education, I think, is quite important here. Now let's summarize what we have learned today. So the first thing is that the general advice for adults is to stay between 70 and 180, or between 3.9 and 10. If possible, safely, as they say, lower the upper target from 180 to 140. And the key idea here was, as I've said, is if it can be done safely. And I've said, for example, that having a good glucose sensor can help you there. And then also, the doctor's advice is to stay in this range for at least 18 hours a day, roughly. That's 70% of the time, or more, of course. Now the rest of the tips are based on my opinion. So one of them is, if you can, get a glucose sensor. The second advice is check it very frequently. And the third tip is learn what you can do to prevent hypos and hypers by timely action. So make sure that before you go low or before you go high, so before you sort of like reach the out of range values, before you reach them, try to take some action. Try to see if there's something you can do. For example, by doing some exercise if it's going high, or by eating something in time before it goes too low. I mean, that's the sort of advice that I would say based on my own experience. One of them is this one, that is called a consensus report by the American Diabetes Association and the European Association for the Study of Diabetes. Two important organizations, and they said sort of like, what are the targets? That's part of what is in this paper. A second paper here, this is a UK paper, Time in Range, a best practice guide for UK diabetes healthcare professionals in the context of COVID-19. And finally, there is a paper, I talked about pregnancy, time in range in pregnancy, is there a role? Again, I mean, that's freely accessible. Have a look. The links to these videos are below this video. Now, finally, please like and subscribe if you like this type of content, and thank you for watching my video. So now at the end of the video, I want to quickly mention where I got my information from.